Good afternoon, everyone. My name is Amy Smallers, and I am Senior Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, presenting a high-level overview of the Discover Merchant Settlement and the Acute Care Hospitals Opioids Round 2 Settlement. A few logistics before we start. If you have any questions during the webinar, please enter them into the chat feature as we are in listen-only mode. Your questions will come directly to us, and we'll do our best to get them addressed during our time together today. I also want to take a moment to thank MHA's 2026 annual sponsors, as well as our strategic partners, for their support in underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members with timely experts and leading experts for the timely issues like the one today. I'm pleased to introduce our speaker from the Managed Care Advisory Group, Adam Schmidt. Adam is Vice President of Business Development and has been with his organization since 2008. He works primarily with their strategic partners, including state hospital associations and large consulting firms, to educate them about their options regarding class action settlements. Thank you so much, Adam, for being here today, and I'll hand it over to you to get us started.
Thank you very much, Amy. I appreciate the introduction. Thank you, everyone, for taking the time to attend today's presentation. I'm just going to pull up the slide deck real quick here. There we go. Again, my name is Adam Schmidt. I'm the Vice President of Business Development with MCAG. I've been with MCAG for more than 16 years, and as Amy mentioned, I primarily assist clients and partners in educating them about class action settlement opportunities, as well as how to file appropriately. Also attending today's call with me is Kim Johnson from MCAG. And as mentioned, this webinar will be recorded, and a copy of the recording, as well as the slide deck, will be available to all attendees and registrants. And MCAG is more than happy to include additional marketing or educational pieces upon request. Excuse me. During today's presentation, we will cover several important topics, including a brief background and a history of MCAG, an overview of the Discover Card Merchant Settlement, the second round of the Acute Care Hospital Opioid Settlement, a little bit about our service and our value drivers and enrolling in the service, and then we'll obviously save some time at the end for Q&A. The presentation should not last longer than 30 minutes unless there are a large number of questions. In fact, the presentation itself is about 20 minutes. If you do have any questions as to whether your organization is enrolled for all settlements or not, please do not hesitate to reach out to Kim, Amy, or myself following this presentation. And additionally, any questions that we may not be able to answer on the spot will be followed up with an email response or call if needed. So first, we'll cover the acute care hospital opioid settlement. Eligible entities include any acute care hospitals in the U.S. That are not owned or operated by federal, state, county, parish, city, or other municipal governments, and treated patients with opioid use disorder, or OUD, for opioid-related conditions. This is the second round of settlements for the opioid settlements. The first round resulted in significant payments to many of our hospital clients, including several clients that received seven-figure checks. The filing deadline for the first round was in March of 2025, and that had a fund of $651 million. The fund for the second round is $174 million thus far, and the settlement claims that defendants engaged in coordinated actions that contributed to opioid addiction, and it aims to cover operational losses hospitals incurred in treating patients with opioid-related conditions. Over a dozen companies remain in litigation in the original ACH opioid litigation case. This case is specifically against the Sackler family, and the fund could continue to increase as additional parties settle. MCAG clients received an average of about $15,000 per facility in the initial settlement. And while this one's not as large, we do expect payments from this settlement to be significant for our hospital clients. A filing deadline of July 15th, 2026 has just been announced. So we're currently preparing to file claims on behalf of all enrolled clients. Just another note, If we did file you into round one, you're already included for round two, so there's no additional action that needs to be taken. Next, we'll cover the Discover merchant card settlement. This settlement addresses allegations that Discover Financial Services misclassified certain consumer credit card transactions as commercial accounts. This resulted in higher interchange fees for businesses, many of which were unfairly overcharged for years. In standard transactions, commercial accounts pay a higher interchange fee than consumer. And so Discover has agreed to set aside $1.2 billion to reimburse affected merchants. So if your organization accepted or processed Discover card transactions between January 1st, 2007 and December 31st, 2023, you could be eligible to recover funds from this settlement. The settlement breaks down class members into three separate categories. The first is end merchants. So this includes businesses directly accepting Discover cards. So this would obviously be most of our hospital and healthcare clients are end merchants in this scenario. It also includes merchant acquirers. This category covers entities facilitating Discover card transactions. And then last is payment intermediaries. And this category includes entities processing Discover transactions on behalf of merchants. It is estimated that up to 11 million merchant IDs or MIDs were impacted by Discover's actions. And in terms of important dates and deadlines, the first two dates on here are only applicable to merchant acquirers or payment facilitators. Essentially, these dates refer to the deadlines for submitting data that could assist in determining damages to class members. So that's really to class counsel in this instance. The last two dates, obviously the March 25th, 2026 deadline just passed, but that was the opt-out deadline. Presumably any of you that were going to opt out from the settlement would have done so already. And typically class members that opt out of any settlement, they do so because they are going to go after the defendants directly with their own legal counsel. They're not going to be part of the class action settlement. However, the most important date is the May 18th, 2026, and that is the claim filing deadline. So unless something changes, a valid claim must be filed in order to receive payment by this date. And so what we always say to clients is, even if you're not 100% sure that you're eligible, there's no harm in us putting a claim in. And we can always withdraw it if we need to later. Obviously, you want to think you at least accept the Discover to sometime during the time frame. But as long as you have a seat at the table, there's a chance to be paid. If you don't do anything and you miss that deadline, then obviously you're not going to be able to receive any funds from the settlement. In terms of next steps, there are really two priorities. The first is to review and confirm information for existing clients. We already have at least partial data for most of our existing clients from filing into the Visa MasterCard settlement. However, it is important that you confirm all merchant ID numbers or MIDs, processor names that were used during the time frame, so credit card processing companies, tax ID numbers, and location addresses. And the reason those are so important is there can be different payments by region. And also, we just want to make sure we're casting as wide a net as possible. So we want to file for every available facility, every location, every available TIN, and merchant ID number. Additional locations or merchant ID numbers can be added in our settlement recovery hub, or you can always reach out to us directly if you need to add more as well. We have included information on how to enroll in the client hub in the next slide if you haven't already done so. So we will cover that briefly. If we do already have all of your information from filing into the Visa MasterCard settlement, you should be all set unless there are any merchant ID numbers that have been added for the years 2020 to 2023. And that's because the Discover settlement covers 3 additional years that were not included in the Visa MasterCard settlement. So basically, Visa MasterCard went from 2007 to 2020. This goes from 2007 to 2023 in terms of an eligible time frame for recovery. Please also remember to forward any claim forms or notices that you receive from the settlement administrator to our attention, as they can be useful in supplementing our filings. You don't need to fill out the claim forms or provide any information or populate any fields like that, but if you can just send them over to us, whether it's just scan all of them and send them in an email, forward them to us, however you want to do it. It's very helpful if we have all those things as well. So whether you're a new client or an existing client, again, we just need those four main pieces of information, and then as well as any claim forms that you may have. As far as registering for the hub, within 24 hours of completing a registration form online, clients will receive a follow-up email with instructions for logging into the MCAG Settlement Recovery Hub. This is a secure portal where clients can upload any pertinent information for filing purposes. Again, examples would include merchant IDs or merchant locations for these particular settlements. Clients can also view the settlements that have been filed on their behalf, in addition to receiving important updates regarding filing status, potential payout dates, etc. And again, if you're a current client and have not enrolled in the hub, we can resend instructions for how to enroll in the hub at any time by request. In terms of updates that we provide to clients, clients will receive regular reporting from MCAG once we've initiated the filing process. An example of a report is displayed here. All clients will receive the class action settlements quarterly reports, which list all the active settlements that MCAG is tracking and filing on behalf of enrolled clients. And this document will also let you know if we need anything for filing into upcoming settlements. And again, you can always log on to the hub to receive up-to-the-minute reporting as well. But we just like to provide as much reporting as possible to clients so they have an idea where everything stands. There are some additional payment processing class actions that we're keeping an eye on. The first is the fraud liability chargeback shift. This settlement involves merchants challenging the shifting of fraud liability from banks to merchants for certain types of transactions. It alleges that the liability shift was applied inappropriately or unfairly, placing an unfair burden on the individual businesses. So far, that settlement has set aside $231.7 million to reimburse affected parties, but it's not a full settlement yet, and the claim form is not available. So it's just another one we're keeping an eye on, and obviously we'll let clients know when that hits. The second is the Visa debit MDL or multi-district litigation. This litigation alleges anti-competitive practices and excessive interchange fees on debit card transactions charged to merchants by the defendant. One thing that's notable about this settlement, it has not reached the settlement stage yet. There's no claim form available, but a ruling was made that if a merchant filed into the Visa MasterCard interchange fee settlement, they can file into this settlement as well. So you can actually receive payments from both settlements. You're not excluded if you filed into one or the other. So that's a good thing. And then the last but not least is the American Express anti-steering litigation. In this case, the plaintiffs alleged that the merchants were prohibited from encouraging customers to use lower fee cards, which resulted in higher fees to the end merchants. Again, no official settlements been reached yet, but with all three of these settlements, as soon as they become active, we will certainly let clients know and file if they are eligible. In terms of your options as a class member, and this is for any settlement, not just the direct ones that we're talking about today, there's really four major options. The first is you can opt out of any settlement. There's usually an opt-out deadline, which you have to apply by. But in this instance, class members will elect this option if they're pursuing defendants directly with their own internal counsel or separate outside counsel. And while this can sometimes lead to larger payments, there are some inherent risks when doing that as well. The first is significant cost associated with additional litigation. And then the second is obviously damage relationships going forward with the defendant. So if it's a defendant that you do a lot of business with and you're suing them directly, obviously they're going to notice that versus generally if you're part of a class action settlement, they just want that issue to go away. That's why they set the money aside. And typically they're not really checking to see who received funds from that. The second instance, you can do nothing. Obviously, in this instance, no money is received, but you're still bound by the terms of the settlement agreement. It is often the case that 80% or more of eligible entities do not pursue settlements for a host of reasons. The main ones are unknown ROI. It's very difficult to set up a budget or have someone spend a lot of time on something where you have no idea what the return will be or how long it will take to get the money. The second is, limited access to data and records. Many settlements go back 15 years or more. Discover is a great example. And so finding relevant data, even from third parties, can be pretty difficult as a lot of it is archived or no longer available. And lastly, it's hard to track all of the settlements that are out there in the marketplace. Notices are kind of arbitrarily sent to the departments that the administrator thinks is most applicable. And a lot of times, our clients aren't just even aware of settlements that are out in the marketplace. There's a quick time frame that you have to file in. And one thing we always notice is, there's some of our hospital clients, depending on what state they are and how big they are, they're eligible for 12 to 15 settlements per year that we're filing on their behalf. The third option is to submit a claim on your own. This is always a possibility. We never discourage clients from filing directly if they think they can do so, obviously. But really what we're trying to do is just making sure that they have a seat at the table for every opportunity that's out there where they can receive cash payment. And then last but not least, you can have a third party submit a claim on your behalf. This is obviously what MCAG does. We track all the settlements. We gather and format all the data. We fill out all the necessary paperwork and online forms, and then we work with the settlement administrator to ensure payment. We really act as your advocate and expert, and we want to cover everything from A to Z on behalf of our clients. A little bit of information about MCAG. We are headquartered in Toledo, Ohio. We were founded in 2003 to provide the class action settlement recovery service. Really, what we do is we act as the authorized third-party filing agent on behalf of our clients. So we are not attorneys, and we generally do not participate in the litigation process. Every once in a while, if there's something we think is extremely unfair in a settlement, we'll object on behalf of our clients. But typically, once the settlement is set up, that's when we're stepping in. There's a process that has to be followed in order to receive funds, and that's when we're stepping in to take over. MCAG tracks and files into every settlement for which our clients are eligible to receive cash distributions. That's the key. And the settlements that we work on are generally antitrust in nature, but the real key is that the organization itself is the class member and eligible to receive funds. So it's not necessarily individual employees or consumers. This is where the organization itself was injured as a result of the defendant's actions. Our service is always provided on a contingency fee basis, which means there are no upfront fees, and we do not get paid unless our clients do. We don't send bills or invoices. Instead, we send a check net of our fee when a settlement successfully pays out, and our fee is all inclusive. So there is no additional charges on top of the straight contingency fee. We've been filing into class action settlements for over 20 years, and we have represented clients in more than 120 cases. As Amy mentioned earlier, we are partnered with over 30 state hospital associations, as well as large consulting firms, PBMs, data clearing houses, and many others to provide this service. Our partners are an extremely valuable source of data that we can often rely on to assist in the claims filing process. And as a result, we've recovered over $500 million for our more than 11,000 clients. And really, I do want to stress that. We'll cover that on this slide as well. But we try to make it so that our clients spend very little time and effort on any of the claims that we file. Quite often, the basic information provided in the enrollment form is enough for us to file into a few settlements each year. And again, our access to data through our partnerships and providing templates for data requests, this really simplifies the process and increases the ultimate payment for a client. So whether it's $500, $10,000, $100,000, or $1 million that you get out of a settlement, if you spent very little time on it, the ROI remains high, and that's very important to us. I said it earlier, but I'll emphasize it again. We do encourage clients to send all notices to our attention. While this is not mandatory, we find that it's a tremendous option for many clients. It helps to provide peace of mind that we're taking it off their desk. It's just one less thing that they have to worry about. But it can also sometimes alert us to industry or regional specific settlements that we may not be aware of because they're smaller, but that doesn't mean that there's not necessarily won't have a decent payment come from them as well. And then because we track every available settlement, we're always increasing the number of opportunities for each client leading to a larger revenue stream. So we often talk about the pipeline. Once you sign up with us, if we file into 5 or 6 settlements in the first year, we're already building up the pipeline, and we try to keep that going each year so that when the first settlement pays out, there's additional ones just waiting right behind it. In terms of our process for operational support, once a client is enrolled, our account management team will continually notify clients of pending opportunities and ensure that all claims are filed in a timely manner. We work directly with clients to provide email templates for data requests if that's needed, and we provide a report of all claims filed and payments made as well as pending payments. We do have years working with the nation's largest settlement administrators, which is a great advantage. That's who you deal with the second that you file a claim. That's who we're working with from then until payment time. And then again, our access to data is really what sets us apart because we work with medical claims clearinghouses, insurance companies, practice management providers, payment processors. There's a whole bunch that we work with. We have a proven record of increasing claims substantially as a result of that process. Our online enrollment process is very quick and easy, and once enrolled, we'll immediately start tracking and filing into all eligible settlements on behalf of clients. Clients can enroll electronically through our co-branded website, and we can send the hyperlink for that enrollment following today's presentation. So it'll be the link for the Massachusetts Hospital Association. Upon accessing the enrollment platform, you can just scroll down to where it says SRS enrollment form, and then organizations will need to include some very basic information, including business name, primary address, tax ID number, number of employees. There's not a lot of information there. It literally takes about 3 to 5 minutes to complete the form. But that's the information we need to file into every settlement, not just these two. And then once you're enrolled, you'll get a confirmation email from our account managers listing the settlements MCAG plans on filing on your behalf. And then at that point, you can also let MCAG know if you want us to pursue some or all of the settlements listed. I will say that the vast majority of the time, most of our clients want us to pursue as many of the settlements as possible. You will receive an enrollment confirmation email. It looks like this immediately upon completing the process. And this email will also include a copy of the MCAG agreement as well, and details on how to contact an MCAG representative if needed. And then to summarize, if you believe your organization is even remotely eligible for the Discover Card settlement or the ACH opioid settlement, and you have not already started the process of filing a claim, I think it makes sense to have MCAG and the Massachusetts Hospital Association guide you through the process. Again, the hyperlink to enroll through MHA will be provided as a follow-up to this presentation, as well as a copy of this recording and the slide deck. And now I'm happy to open it up to any questions. And again, if we can't get to them all today, we can always make time later as well.
Hi, Adam. Yes, thank you so much. We do have a question here of there's an organization that receives some Discover notices for locations for the hospital that reference a different tax ID. How should they be handled with you, or is that something to take offline? I guess is a
No, it's fine. What I would say is send all of that information over to us if you're enrolled with us already, and then we can go back through and check to make sure that we have all the tax IDs. What we try to do for any client is just really simplify. So if you have a Word document or an email or an Excel sheet that lists all of your tax ID and locations, we can go back and check that with the administrator of what you received already. And so I'm happy to go offline and talk about that more. But if you just send all that over to us, we should be able to figure it out pretty quickly.
well, excellent. I think so. Those are the questions we have today, but we'll also, as you mentioned, there's a lot of great information in here, and we'll be sure to send everyone, as you share the recording and the slides and your contact information, as I'm guessing some questions may come up after this of going through all the documentation. So, oh, there is one more question. Do we have to be members with MHA specifically to be part of this?
To be part of the settlement?
I believe so. It's MHAWBR. I'm not exactly sure what
Oh,
that.
I'm sure that's just the enrollment code that
Oh,
you can
okay.
use. But we'll send out. I'll send over to you, Amy, as a follow-up. I'll just make it really easy. It'll just say hyperlink to the online enrollment platform and it'll have a code. You can use that code, but there's another code for MHA as well. Just to be more general, you don't have to be a member of the MHA to file a claim, but if you want to enroll through the service, yes, you do have to do that through MHA.
Great, thank you. I appreciate the clarification.
No problem.
Excellent. So again, thank you so much for your time and information today. This is really important, and I appreciate all the work you and your team and organization does for our members on this.
Sure. And if any questions do come up after, feel free to email me directly, Amy. We'll make sure we get to you in a timely manner.
Great. Well, thank you again, and thank you all for joining us. And check out for our future events that we have coming up, and we look forward to seeing everyone soon.
Thank you so much.
Thanks.
Okay, bye.